All right, Dr. Bunio, they keep giving us microphones and letting us do this. I'm not sure why yet.
I'm amazed myself.
So welcome from the community here. We're going to talk some more about COVID-19. I know that we've had an uptick in the cases. And, before we get started, I kind of wanted to talk to you, though, about what it's like to be res famous now. You're basically a celebrity. When you go out to eat, people are bothering you for autographs. What's that like?
I think it would be great, but because I am wearing my mask all the time, people don't recognize me. So I'm able to sort of blend in with the general population. And
that's true.
The paparazzi have no idea.
When this is all over, it's going to be hard for you to, you're going to get to smile and remove your mask and see people, but they're not going to recognize you unless you have it on.
It'll be tough.
That's going to be tough.
Yeah.
And so we've got a few notes to share with the community today. We've taken some more questions in. And again, I mentioned earlier that there's been kind of an uptick in the numbers. And so a lot of things are being checked. We're urging for testing. We're trying to get folks to come out and get that testing done so that we can track this thing around. And real quick, I wanted to share the informational hotline on COVID-19, 497-3743. We've got a few exciting things to mention today, some new things. And so it's important that, everybody that can watch this or share this with your friends out there in the community, that you pick up on this and share it. And so we'll go ahead and dive real quickly into some of the questions, and then we'll talk about some of the new things as well. So what is community spread? Because that's been kind of the term that's been tagged to this particular uptick in numbers.
Yeah, so community spread is basically when we get cases in the community that we can't tie back to someone traveling here, or even if we can tie it directly to someone in the community, then that's controlled.
Right.
But if we get new cases popping up, then that's community spread. That means kind of like what we've been saying all along. It's out there.
Right.
It's in this community. And we're going to have to be extra vigilant and diligent about trying to protect us.
And so leading into the next question, that's important because we're seeing a lot of asymptomatic positives at this point. What is an asymptomatic positive?
So that means you have contracted the virus, but you are showing no symptoms.
Right.
You don't have a runny nose, you don't have a cough, you're not sneezing, no fever, nothing. So you don't know that you have it, and that's why, of course, it's increasingly important for everybody to wear a mask.
And that's been the tricky part of this particular virus, is that it has a lot of asymptomatic carriers. Is that right?
That's right. We have somewhere, depending on who you read, somewhere between 35 to 50% of the patients are not going to show symptoms, and they can be out there talking and spreading these droplets that have the virus.
Right.
We also have what's called pre-symptomatic cases. Okay. That means you've got the virus, and there's about 2 days on average before you show symptoms.
Gotcha.
So you're going to start feeling sick, but for 2 days, you can be out there shedding the virus. And we actually think that people who are in that pre-symptomatic phase spread more virus than somebody later on in the disease. So that's the real danger time. That's why it's so hard to control this virus.
And that's why it's been so important for us to get this testing done, whether or not you feel bad or like you have any symptoms, is to come on out and continue to get testing every few weeks to make sure that you're keeping your household safe.
Yeah, that testing of people who are feeling fine, that's really key to us picking this up before it gets out of control.
Right, and it's kind of it goes against the grain of what we're used to. Normally we recommend you come get tested once you feel sick. This is different. We recommend you come even if you feel fine, especially if you haven't had anyone from your house come and be tested.
Yeah, and I think, we talked about, can you be retested? We talked about that last week.
Frequency.
Yeah, if it's been a couple of weeks since you've been tested, by all means, go ahead and get tested, or send another member of your family to be tested, so that we can be sure that your household at least is a COVID-free zone.
Good. And we'll post, I know that with this and some other posts out there from the hospital and other leadership, we have the schedule of testing happening, and so everybody can get out there and get tested. Even today. If I test positive, what should I do to help out to not spread the virus?
Okay. Well, so this is all about isolation. You need to isolate yourself from other people. If you can do it in your home, that's good. We basically want you to maybe find a room that nobody else goes in. If you can manage to have a private bathroom, and basically just stay away from the members of your family.
How long are we talking about this isolation?
Once you test positive or start showing symptoms, we believe that you're contagious for 10 days after that.
Okay.
Now, and I guess the most important part of there is you're not only isolating yourself from your family, you're isolating yourself from the community. So
Gotcha.
it's stay home.
So introverts out there are actually kind of excited about the opportunity to continue to isolate.
Yeah.
Yeah. So there's folks out there that aren't bothered by that, and some are looking forward to isolating in general, even if they don't have the virus.
Yeah, and again, a lot of people are going to feel either no symptoms or mild symptoms.
Yeah.
Unfortunately, we have had some cases that have gotten very sick.
Right.
It's really hitting home. There's people that we know who are fighting for their lives right now.
Yeah, and I think that's important for the community to know that we do have members that are fighting this virus right now as we speak.
Yeah. But for those who are mildly sick, again, we recommend you stay home. Call the hospital if you have questions. Don't just come into the clinic.
Right.
Don't just come to the ER. We can tell you when you need to come in.
Okay, so isolation is the key to this if
Yep.
you test positive. Just please try to keep it contained while we sort it out. With the rise in positive cases, who should be more concerned at this point?
Well, the short answer is everyone, but in particular, we want people who are caregivers or patients who are in these high-risk categories.
Right.
So we're looking at people who are elderly, people who are, have other conditions, diabetes, heart disease.
Underlying medical conditions.
Yep. And we're also particularly concerned in the members of the addiction and recovery community.
Right.
A lot of these individuals, their immune system is down a little bit. Sometimes they don't have a stable place to live, and so that puts them at high risk.
Gotcha. So it's very important, I guess, again, to reiterate that for the caregivers out there, for folks that are interacting with people that are in these higher risk categories, to make sure that they're taking all precautions at this point. Even if they've been tested, even if they, things feel like, I feel fine, you got to imagine, again, as we've been stating for weeks, imagine everybody has it, including yourself.
Right.
And protect those people most vulnerable.
Yeah, and that's a good point. So what we're trying to do is we're trying to protect both. We're trying to protect the caregiver from bringing it into the house and giving it to somebody who's really susceptible to the disease, but also prevent that person, that the person's caring for from bringing it into the house and making the caregiver sick.
Right.
In some cases, that caregiver is vital to the health of that person, and if they get sick, it's a real challenge.
Good. Well, my hair is growing out of control right now. It's kind of falling down on my face, but it's because I'm trying to start a rock band coming out of this. I'm really want to do that, and I figure, maybe I can get on one of the stages downtown and play.
I think there's availability now.
But nobody will come. I mean, obviously, I'm bad, and so I figure it kind of win-win for all this situation. We don't want a gathering of people, but it would actually disperse people if we have a gathering to put me on.
That might be a good
and
strategy.
let me play guitar for a few minutes, and people would just kind of like leave. So I'm working on that. How do you stop community spread?
Well, one of the things that we want to just go back to is the testing. So we want people to continue to be tested. We want to find it in the community.
Right.
And we have a contact tracing team. You may get a call. Again, we talked about this before. If you get a call from the hospital, please pick it up. It could be very important.
Dr. Bunio, how important is it once we identify folks that are positive, if they share that with the community themselves? Obviously, there's HIPAA issues where we wouldn't, the hospital and staff wouldn't be mentioning anything. But how important is it for the community to have some empathy for folks, or sympathy even, for folks that are contracting this, and as a community, what do we do to support each other? Is that important at this point?
Yeah, it is, and I think it's very important. You're right. We have certain confidentiality restrictions with what we can put out there, but we've had a few people who have been very brave and stood up and just announced to the community and their friends, hey, I'm COVID positive. If you've been around me, please go get tested. I mean, and all I would say is the community has to receive that in the spirit that it's given. Don't get mad. Don't, post anything nasty on Facebook. Say thank you. Go get tested. They're doing it to help protect you.
Now, the chief there's going to be testing today from 1 to 3 p.m. at the Drama Hill. So today's Wednesday. If you're catching a rerun, this is Wednesday. But the chief will be out there today to hand out masks for any community member who does not have one. And I think that's a big thing. If you don't have a mask, or if you need that extra mask in another vehicle or at home or at your workplace, go out today, get tested. That's free and simple. Plus, you get to pick up a mask and say hi to the chief or give him a wave. But we talked about something regarding that, right?
Yeah, that's right. So I thought we'd spend a little bit of time today talking about the 3 W's.
Right.
That you guys have probably heard from North Carolina Department of Health. And so the 3 W's are wash, wait, and wear.
Okay.
And so let's start with the first one. Wash your hands. And we've talked about that over and over again.
So what's one of the techniques when you wash your hands that you go by and
Well, originally the classic technique is to make sure that you're washing your hands for 20 seconds. And so one of the little tricks was you could sing happy birthday to yourself twice.
Okay.
I found that I was getting a little tired of happy birthday.
Right.
So I Googled it and I found some other songs.
You have a playlist of songs
I actually have
while you're washing your hands.
I have a rotation of songs.
Let's hear them.
Well, if you do the chorus of I Will Survive or Staying Alive, that goes about 20 seconds.
Okay.
My personal favorite is Keep Your Hands to Yourself by the Georgia Satellites. And, of course, I tried to make Don't Stand So Close to Me by the Police work. It's about 24 seconds. But
it's a little longer, but that actually helps a little, right?
But it's worth it.
Right.
And so it also, reminds me, hey, these are these other principles that we need to follow.
Right.
Which gets us to the next one, which is wait.
Well, hey, before we go there, if anybody in the community has a good song idea to sing that's related to this pandemic for washing your hands that could help others, post that in our feed, in our comments today, a song that you recommend singing while you're washing your hands. I think that's a really cool idea, and maybe we'll play it on the next, we'll play the best one on the next episode we do.
Right, and that reminds me of another thing about the mask that we talked about earlier. So I wanted to ask you, Chris, have you ever ridden a motorcycle?
I have ridden one. I don't own one. I've never owned one, but I have ridden on one.
Well, I don't know if you've noticed, but I notice every time a couple of motorcycles are coming by each other, they always give each other a little wave.
Yeah, usually when I'm snuggled up real good,
Yeah.
I'll stick my hands out and wave a little bit.
And
Jeremy will let me lean over and wave a little bit.
And that, to me, that's like them just saying, hey, we share the same sort of values and ethics.
Right.
I would like to propose to this community that when you see somebody wearing a mask and you're wearing a mask, give them a little wave, little thumbs up.
Yeah.
Just to say, hey, we get it.
I like the thumbs up thing. I've been on a thumbs up kick. You don't have to be the full one, but if you could just kind of.
Yeah, okay.
You're cool. I like that.
Yeah, and I think we need to reinforce that, because as we've talked about many times, you're wearing that mask to protect me.
Yeah. I'm
wearing this mask to protect you. So it's all about caring for each other in this community.
In our community, mostly.
Yep.
Great. So thumbs up when you see each other out there in public. If you've got your masks on, a little thumbs up. You're doing your part. Because you can't see the smile and you can't see the lips, because, we're pointing, but you can't see it. So I don't know how natives are pointing right now. But do the thumbs up. Yep. That's cool. I like that. So let's talk about the other W.
So, that's wait. And that's sort of a reference, I think, that, to being at least 6 feet apart.
Okay.
So if you see somebody, you want to stay 6 feet back.
Right.
When you're in the grocery store, so I follow the arrows. Everybody's seen the arrows.
Right,
You're only supposed to go one way. I follow those arrows. And if somebody's in front of me, I kind of slow down and I keep that 6 foot distance.
Right.
Now, if they're sort of looking at the cereal for, 10 minutes, I scoot by them real fast. But the other thing that I do, and I'm going to add another W here, and feel free to pick this up, North Carolina, is
copyrighted though.
If I see somebody coughing or sneezing, I walk away.
Oh, gotcha.
I am not going to follow.
Walk away.
We talked about there's this cloud of droplets. I'm not going to walk through that.
Right.
Now, when I'm in the food line or not the food line, but the Walmart, I kind of back up. I mean, I don't want people to see me going the wrong way.
Right,
so I just do a little moonwalk or something backwards, and then I get out of that aisle. And I go somewhere else. To me, coughing and sneezing these days is scary.
It's a scary thing.
It's almost like when I hear a rattlesnake.
Yeah. And very, very scary. Actually, maybe more scary. So with that being said, and something we had mentioned earlier is that, if you're the one in this situation, someone sneezes, someone coughs, hopefully they take all the precautions, they're wearing their mask, they use their sleeve.
Yep.
thumbs up and move on to another area. Don't just eyeball them and give them that real mean look. I had to sneeze the other day in the store and it freaked me out. And I know how it feels to be on that side of it. Just, it's uncontrollable, obviously. I mean, I tried real hard. I sneezed loud too, man. My eyeballs almost pop out. But, just, I'm sorry. I sneezed in my mask into my arm. I apologize. Anybody around me, don't come over here for a little bit. But, yeah, take care of each other.
Well, and we're in allergy season too.
That's
so
true.
People are going to be sneezing. If you're a person that suffers from allergies and you're sneezing, just remember, that could be your allergies.
Right.
But you could also have an asymptomatic case of COVID.
That's true.
And when we sneeze, those particles come out 100 miles an hour. I mean, there's no way to get away from that.
Right.
So even though you're not meaning to, you could be spreading the virus. The allergies are helping too.
For me, it was a nose hair had tickled the left nostril, and it's uncontrollable until I cut the nose hairs. And so with that being said, we've also talked about, there's a lot of hashtag. It's new for me. I'm sure you're ahead of the game with the hashtag thing.
Yeah, certainly.
But we wanted to kind of create our own community hashtag.
Oh.
Just for us here in Cherokee. It's kind of a pride thing. I think it'd be fun to participate in. And somewhere down the road, we may even be able to incentivize or give some kind of a prize for the people that participate in this. And so if you see, if you wear your mask out, or if you have family wearing their mask out, and you would just kindly take a snapshot of all these cool masks. I know it's been happening for weeks, and it kind of, some people are kind of over it, but there's a lot of still cool masks coming out. Hashtag Mask Cherokee. That's going to be our hashtag. Hashtag Mask Cherokee. If you'll just capture that image, put it on your social media, hashtag Mask Cherokee. We'll get to share that with each other. I think it's something to be proud of. And as soon as we get off the air, I'm going to be hopefully the first, and the community doesn't beat me to it. Everybody hold your horses to hashtag that and put a picture of us with our masks on there from 6 feet apart probably, but or at least the 4 or 5 feet we are now. And so we'll get the Mask Cherokee hashtag out there. Hopefully people will share that and become a part of that. Let's see if we can't get 500 pictures by the end of the week. I think that'd be a cool goal. Be a part of that, and let's keep that going. Again, like you said, a lot of these little things, thumbs up when you see each other. Taking care of our community, taking care of our vulnerable members. This is all just part of the story right now. And I don't know if we had any more questions. Oh yeah, we're getting into our last part.
Okay.
This is really exciting too. So we got another question after that? Yeah. Okay, so after we go through the virtual urgent care, we've got another message. So what virtual urgent care sounds really intriguing to me. I'm a techie person, but what is this?
Well, as you know, we had to shut down the urgent care, the immediate care clinic. Right. And so what we've been working on over the past couple weeks is standing up a virtual urgent care. And by virtual, it means it's all done through the internet or through your cell phone. Okay. So what you can do, and we've been doing a lot of these visits in primary care already, but if you need a visit, we're going to give you a number to call, and we'll set up a time. And then when it's time for your visit, you can get a little text message on your phone. It says it's about time for your visit. And we will connect you with a provider who will try to take care of your issue. And if they can't, they might order some tests, or they might tell you to swing by the office if we need to do something, if we need to lay hands on you. But our goal is to, provide as many services as we can as safely as possible. Right. And, this is one way to do it. It's called telemedicine or telehealth. And it's an audio and visual. So we can see you. If you want to show us a rash or something, you can do that. We can also do things over the telephone. Some people have bad connection. I was getting ready to say, now if you have a bad connection, I do know that in town we have our free public Wi-Fi. Yep. So if you can at least make it into town and do it that way, that'd be great. I know if it's in the downtown area here, if you can make it there. But if you have a good connection at home, this is an option for you. It is an option, and if it works, it can solve a lot of problems so that you don't have to come into the hospital, come into the clinic. That's great. If we lose connection halfway through, we can convert it into let's just call you on the telephone and do what we can then. Well, good. Or we can just say, listen, the connection, my internet's been going in and out lately. Okay. Usually when I'm trying to watch something on Netflix. Yeah. And that's understandable. I think a lot of people are using up the bandwidth. But you're right in the middle of season 8 of House, and it just shuts. I'm imagining House is what you're talking about. Yeah, that's a good thing to imagine.
But no, that's great. So I think leveraging technology in the community here to benefit the population and to help each other stay safe. And in addition to, I mean, it seems like it could be fairly quick too, and something you could get in line for pretty quickly.
It can be. I mean, the system would allow you to just kind of sit there and wait,
Okay.
but we didn't want people sitting on their phone for like maybe an hour. So
That's
that's
cool.
why we want you to call. So we'll give you a time.
Good. Okay.
And yeah, we hope it takes off. I mean, if
So where would someone go to get in on this?
there's a phone number. Hang on, I think
I got you right here. Yeah, I wanted
Yep.
to. So you would call this phone number 497-3744. I don't know if we don't have a slide.
Do you have
do
a
we?
slide? No.
497-3744 to get set up for
Yeah.
the virtual urgent care. And what we'll do in the next one is we'll continue to push this out on social media,
Yeah.
and we'll put it on the post. But we'll get that phone number out there to get some people to get some testimonials as to how that works.
Right. So someone will take your call. They'll explain it. They can even do a little test of the system to see, do you have enough bandwidth where you are for it to work?
Good.
And then they'll give you a time. And as I said, the system allows us to just shoot you a text message, and just you log in, and your provider should be right there.
Good.
It's pretty much like FaceTime.
And I know that leadership is looking at this and hopefully watching some of this and understands the need for us to continue to develop our infrastructure for our communications, our internet services to our public, so that we can get everybody out there the opportunity to use this. Because and it's not just this, and I don't want to get political with it, but we've got to, the school systems need help with that. Public health needs help with that, and the hospital staff as well.
Yeah, that'd be great.
And so we're going to work on that moving forward.
Okay.
So we had another question.
We have 2 questions.
Oh, 2 questions. Excellent.
If you test positive, how do you self-quarantine from family if you live in a small home with just one restroom?
Okay. That's going to be challenging.
You may restate that
I'm
question.
sorry, yeah.
Yeah.
So the question was, if you test positive, how do you self-isolate or quarantine yourself if you live in a small household with only one bathroom?
Mm-hmm.
That's going to be really challenging. So if you test positive, you're going to be contacted by public health or our nursing staff to give you your options.
Right.
If you only have the one bathroom, if you can at least get a room to yourself,
Okay.
that'll help. Using the bathroom, you may have to wear a mask to go to the bathroom. Make sure that all the surfaces are wiped down after you use it. It's not ideal, but that may be the best we can do.
Good.
Now, we had been looking into options to, provide, like hotel rooms for
Right.
people. But with the summer coming, the hotels are hoping to get back into business.
Right.
And so that's going to be a very limited option. But
Okay.
if you have if there's any place you can go,
Yeah.
like if you have I don't know, if you have a cabin or something, you can go to just to stay away from your family, or
Yeah.
have some of the members of your family go live with other relatives for a little while. It's not going to be easy.
So it's not an ideal situation, but it's certainly something we need to make every effort to make
Yeah.
it work.
Yeah.
If anybody out there has needs for emergency supplies, figure out if you can get a family member to contact any of us. We'd be more than happy to share any kind of cleaning supplies or anything that we have or that we can acquire to help with that as well.
Yeah,
So we'll
and-
make sure everybody has every opportunity to be safe in this.
Yeah, and public health has been working really diligently in these cases. They'll drop off medication.
Good.
We have people that'll be calling to check on you every day,
Yeah.
see how you're doing, make sure that it's still safe for you to stay at home.
Okay. What's our second question?
What is rapid testing, and how is it determined who receives rapid testing?
Okay,
Good
well,
question.
there's a lot of different tests, but they can basically be broken down into the one we do up at the drama and the other sites.
So the question is about rapid testing.
Yeah.
How does one get rapid testing? How do you determine who gets that?
Right. So the rapid test is one that we have at the hospital. We have and it's still a nasal swab, so
Okay.
it's the same as the one that you do up at Drama Hill
Okay.
Loop. The rapid test is run on a machine, and we can get a result back in 3 to 15 minutes.
Oh, wow.
But
You said
there's-
it's nasal. It's the same. It's
the
not
same.
blood.
No, it's
Okay.
not blood.
Okay.
The antibody test is blood, and
Okay.
we've talked about how that's very they're very limited usefulness
Okay,
of
gotcha.
antibody testing. But a rapid test, we do have those available. We have a limited number of tests available,
Okay.
and there are some problems with the rapid test. So, in a nutshell, if we do a rapid test on you and it's negative, about 50% of the 50% of the time that test is going to be wrong.
Okay.
So you get a result real quick, but it's not terribly reliable. Now, if the test is positive, we feel pretty confident that we can rely on that. So currently, we are reserving those tests for inpatient, for the emergency room, and for those people that we need to urgently transfer somewhere, like the nursing home.
Right.
We're really trying to protect those. I would not advise people to go to the ER to ask for a rapid test.
To look for a rapid test because of the fail rate, as they're saying.
So, so if you're worried, Chris, and you go and get a rapid test and it's negative, I would say to you, okay, you still could have the disease.
Go get the regular one.
Get the regular one.
And just self-isolate for a bit and wait till you get your results.
Yep.
That'd be a good move, right?
Yeah, and we're averaging about 3 days, 3-4 days for those. They're much more reliable,
right?
Much more sensitive. So,
okay.
And plus, when you use the drive-through, you save us from using up all of our masks and gowns and gloves, which we may end up needing. As we've talked about before, we're seeing a uptick in cases,
right? And
we're trying real hard to stop that from spreading.
Okay. So last week I hit you with some questions that caught you off guard, but I wanted to ask about your Mount Rushmore of movies related to COVID-19.
Right. Well, I know for sure that I decided that my new favorite movie was The Mask. Instead of Henry V, because I don't think there was any coronavirus.
Yeah, you couldn't tie it together. There's a king, there's like.
Yeah, the man in the iron mask, that's another one. And I'm going to leave my other two on there because, which would be Henry VIII, because I still love that one. It's sort of, a small group. It's that We Happy Few speech.
Yes.
You remember that?
Yes.
It's where a very small group just bands together and they survive overwhelming odds.
Okay.
And so I think that's really relevant today.
It is relevant.
And relates to really good leadership, which I think we do have. We absolutely have. So I really love that movie. And The Shawshank Redemption. You can come back from a lot of things that knock you down.
So not The Mask of Zorro.
Sure. I'll throw that one in. I actually think I did try to watch that once. I don't think I made it through the end of that one. Yeah, it's kind of an old movie. But
and Behind the Mask, The Legend of Leslie Vernon.
Sure. Yeah.
I recommend that one.
Okay,
to the public.
Yeah, I'm gonna watch that one.
Well, Dr. Bunio, thanks for coming on again today. And if there's any questions from the public, please post them on our Facebook here, and we'll certainly get to them as we can. And we want to make sure that everybody has the information that they need. I guess we'll see you again very soon.
Yeah. Thank you, Chris.
No problem. Data Dog Bunio.